Hello and welcome to Note to File, a clinical research podcast.
A collection of interviews, candid commentary, and general nonsense for the clinical research community.
Check us out at notetofilepodcast.com.
And now, without further ado, on to the show.
Hey guys, hello, welcome to another Note to File Live. We're doing things a little bit different today. I'm going to try to do a little round robin, I guess, if you will, sort of share the stage. Denali is off today. She's starting an opposing podcast. So not really, but I think she'll be back next week. So if you're interested and you want to come on, shoot me a message on LinkedIn. I'll do my best to keep up, as I'm also trying to halfway pay attention to keeping the show going. But I'll send you a link. You'll come in, be backstage, and we'll kind of rotate people through depending on how many people show up or how many don't. So that's it. I'm going to go ahead and jump right in. I'm going to bring on our first guest here, Maria Ladd. Maria, how's it going?
Oh my God, Brad, it's going absolutely amazing. I'm so happy to be here with you.
Yeah, glad to have you. Thanks for being brave and jumping on here last minute. I know that can be a little anxiety inducing for people, but tell us a bit about yourself. What do you do, Maria?
Let's see. I've been in the clinical research industry for about 20 years, coming up in February, and I am currently out of the permanent employee land into consultation. However, I'll be honest with you, Brad, in the last several months, what has happened is that I am about 100% clinical research site advocate and about 5%. And I know math isn't my forte and that didn't all add up, but yeah, I don't do as much consulting. I really do much more advocacy, which is not necessarily a paying gig, but truly my passion. So, you know.
Well, I love that. I don't think we can have too much site advocacy at this point. So,
no, there's not enough site advocacy. And to be honest with you, sites, I think that, there are a lot of sites who do this really well, able to advocate for themselves, but not nearly as many as need to. I think in general, if I'm just throwing out a very broad statement, most sites don't really understand how to do that for themselves, what it is they need to do, the conversation they should have with the sponsors and CROs, mostly because they don't know what sponsors and CROs are thinking. And right. So a lot of what I do when I'm chatting with sites, which I chat with sites every day I have site meetings on my calendar. I tell them, you are in the driver's seat. You're in the driver's seat. You just don't know it. That's all. You just don't know it. And you don't know what they're thinking. Here, what's your problem? I'll tell you what it is they're probably thinking and why it's a bit of an obstacle for you.
Right. I think that's tough as a site. I've been on the site side my whole career, 15 years on the site side. And I think these are things I intuitively know, but even I have trouble sometimes acting on, just because you get so it's easy to get bogged down in sort of the day-to-day at the site level and literally just keeping your head above water. We all know all the statistics and all the anecdotes out there about sites being understaffed and protocols being so incredibly complex. But running a site, even working at a site is incredibly complex. There's so many moving parts to what sites do, which I think is often sort of underappreciated and undervalued, but it can make it hard to sort of sometimes step back and get a little bit of the bigger picture.
Yeah.
And I think, again, I find even though I try to think of myself as very cognizant of that, happens all the time. All the time.
Well, when you get in the weeds, what can you see, Brad? You see the weeds, and it's really difficult to pop your head out. It's hard to poke your head up and see. And a lot of that is because most sites don't really understand the CRO and the sponsor perspective, right? You don't know what it is they're thinking out there. And just to be, really transparent and say this, I've said it online, I've said it on LinkedIn, but I have very little site working at the site experience. I worked as a contractor with a site that was research naive, because not that this PI wanted to necessarily do a lot of research, but there was a passion project for her with lymphedema, a vascular surgeon. So I went in and I helped them do that. That is my site experience. The other side of my site experience is from the sometimes grueling, nearly always inhumane assembly line fashion in which it happens at the CRO. Now, I know why it happens that way, and I am not denigrating CROs. I'm just calling out what happens. So, as somebody who was starting up sites, and sometimes having as many as 60, that's a 6 and a 0 that I had to get started. How can you do it other than assembly line? So I had to fashion some processes for myself. I had to learn. I don't snap well, but anyway, figure out, how do I talk to people? You got all different personalities are on the other end of the line, other end of the email. And for everything that I had control over, I did it with, sincerity and gratitude. And I did a lot of work on behalf of sites. Like I would fill out the documents. Let me, whatever it is I can do for you. That's how I did it. And that's how it ought to be done. But I was working weekends, nights, sometimes Memorial Day, the Sunday before Memorial Day and Memorial Day, I was trooping on into my CRO because I had so many sites to deal with. So, a lot of these problems don't come from the people that you have the contact with at your CRO or at your sponsor. The problems start way up here for them, just like any organization, like any corporation.
Yeah. I think that can be, again, hard at the site level to have any insight into. I mean, it's all very sort of opaque, right? And like you tell your CRA, love our CRAs, you get all different kinds. It's great, but they're dealing with, dozens of other sites across many other protocols. When you express something to them, you're not so sure it's being escalated to anybody who's going to care about it. And I don't blame the CRAs for that. Again, they've got their metrics to hit, or whatever the case may be. So it can be challenging to remind yourself, okay, maybe I need to talk to somebody else, or something else is happening. It's not the CRA's fault,
right?
In this case, which again, when that's the only point of contact you have, I think that's just makes it hard to have that.
It is a flashlight in the dark. You're going into this big dark room. All you have are the little flashes, and you see whatever you can see, and then the light is off again, Brad. I don't like the way that happens for sites. Part of my mission on my own, one chick at a time, with the Clinical Research Site Collective, Clinical Research Site Recognition, I'm here to talk to everybody and anybody who will listen, and am actually in conversations with larger organizations to try and pull this together, right? Because it doesn't matter. I could talk to you all day long, and that's great for you and me. That's great for you and me, but that's not doing anything for the 10 other people around us who don't have that flashlight into the room. So it's really time for the conversations to get started, the real conversations, partnership conversations. And that does include sites need to be better prepared. Some are just not, Brad. They're not. CROs need to be the middleman that the sites need, that the sponsor needs. And not necessarily are they always. And the sponsors need to be prepared just to handle the problems. If you're going to hire a CRO, let the CRO do the work, oversee it the way you're supposed to. Please, dear God, don't micromanage it. There's so many things. It's not just one entity. I've seen some of the things that you post, though, like when you post parts of emails or contract stuff, and it's like, oh my God, I can't believe people are doing that. They're still doing that. It's awful. You should.
That's just the tip of the iceberg. I try to show a little bit of restraint. It's hard to believe. As hard to believe as that may be, I feel like I still show a lot of restraint in some of the stuff I could be putting out there.
I gotta tell you, sorry, I just gotta say this. 2 years into watching you and following you, I would say you have developed some.
I think so.
Yeah,
I'm a little more chill. Also, just some of it's the
resigned.
ebb and flow. Well, some of it's the ebb and the flow of like my business too. Like if I'm on LinkedIn a lot, you can guess that like there's probably a little bit of a slump right now, and I'm
Bingo, bango, bongo. Right.
otherwise, if I'm busy actually trying to work on work, then LinkedIn takes a little bit of a back, goes to the back of the line. But tell me a little bit about, make sure I say it right. It's Clinical Research Site Collaborative, and then I know you guys have like some events like tomorrow.
Yeah. So Clinical Research Site Collective.
Damn it! See, I messed it up.
You had it.
Close.
You were so close, man. You're getting a nickel for that. So this actually was born out of your event from SOS. That's why I tagged you guys in there, because when I went to the event, which I gave feedback, I gave a lot of really transparent feedback to your organization for that. But I asked sites over and over again. I was fairly new to being a consultant at that point. Okay. And I was like, well, I'm just going to go to this because I didn't get to go last year. So I went and I asked sites over and over again at the table, in the hallway, in the, after the sessions, which were really awesome. I enjoyed those. But where do you go to connect with one another? Where's your space? Where's your place? Nowhere. This is what everybody kept telling me. I was like, listen, I have no fears. And I just said, well, I could do that. I'll do that. I'll put up this LinkedIn page and everybody will flock to it and life will be golden. Well, first of all, LinkedIn groups, not a page. LinkedIn groups is not a great way. LinkedIn is not a good platform for this. Can I just tell you, it's really not. So I'm not going to get into that. So I said, well, I'm going to do a page and that will make it all better. Life will be cozy. No, life was not cozy. But in the meantime, I paired up with Amy Ford from Curo Research, and she's completely from the site side. So I've got the sponsor CRO perspective. She's got that. And so we said, you know what? We need to build a first of its kind, best in class community that is actually literally interactive. And so that's what we're working on. We're working with a web developer because everything that we want to do for sites and have ready for them resources and capabilities for them to use, it is quite an undertaking, not an inexpensive one. We're going to be going on a little bit of not a GoFundMe, but a little bit of a campaigning fundraising thing for this, because all the capabilities are expensive. And we're going to keep the cost of it very low for people, So anyway, and then the other thing is, and I want to talk about you as a site owner about this, and that is the clinical research site recognition. That is the love child, the passionate fruition from the collective. Because no matter how much I talk, you talk, no matter how much people talk, the same things keep happening. And I don't know about you, but that's pissing me off. It's pissing me off, and I don't have time.
Obnoxious.
And conferences, we go to conferences and nothing freaking changes, right? I want conferences to start talking about, what did we talk about last year? Who is working on those things? Who can we call out? Who can we help support? And let's start seeing some movement. I'm really sick of seeing no action come from intention. So, and I don't have a lot of years left doing this, Brad. So chop,
Yes,
so it's really past time that the clinical research site is held up as a foundational support to the whole clinical research industry. And with the site, I wholly include participants and communities, because without the participants and communities, the sites will not be able to, they won't be able to enroll. And I include DCT in that. It's not just who you can actually reach out and touch. It's everything. This is global. It's absolutely necessary. Just like, and I hope this doesn't get me in trouble with anybody, but just like Black Lives Matter needs to be said in those words, because until all lives matter, Black Lives Matter, we need to hold up the clinical research site. Does all of clinical research matter? Yes, it does. But we are ignoring the foundation. And in my opinion, we treat, as an industry, the site as a speed bump. Yeah. So I want to hear your thoughts on a day and a week to intentionally recognize the site efforts, but also I want you and your audience to know this is a year-long endeavor for me. This is years long. This is every day for me. It's like Mother's Day. Every day is Mother's Day, right? Tell me how you feel about this kind of initiative.
No, I mean, I think it's great. And like you, I mean, obviously that's a lot of why I've, been as outspoken as I have. I mean, I do think sites are incredibly undervalued, and even beyond that, I mean, frankly, kind of shit on, like, and it's the only place where patients are enrolled in trials, our research sites. That's where again, and consider the source, but the most important thing happens is at the site, because you can write protocols, you can make budgets, all these things are important, but they're all for a reason, which is to collect data, which it requires enrolling patients at the site level. And so it's, unfortunate to me that sites feel like the sort of like the cashier of the, industry, where it's sort of like site personnel are often, I mean, the least paid, given the least resources, and generally not given a bigger seat at the table than what they, probably deserve. So
in the dark,
yeah, you're definitely preaching to the choir here. And I do commend, because I mean, I remember being on stage at SOS and saying, like, go out and create community, because it's something I've tried, admittedly fairly half-assedly in my own, as is my my way, but creating Slack channels, getting as many site owners as you can in there to discuss in real time, and be able to just create a place where people can lean on each other, because also, like, we're all very isolated in a lot ways, and
in all ways.
Yeah, that's true. That's probably, I think it's getting
intentionally, in some part intentionally.
Yes, and I don't disagree with that. I don't disagree. I think that's probably true. I mean, yes, and I've seen instances where being in a study with a high enrolling sites, and I want to talk to those sites to learn from them, but then I'm sort of like, no, you can't do that. Well, why not? Like, why can't we all work together towards, the thing is, there's like enough out there. There's not scarcity when it comes to this. If anything, we need more. So yes, I don't disagree. We need more sites. We need more sites sharing information. We need more everything.
Yes, there is more than enough. There is more than enough out here in this pie, or maybe the pie, because pies are finite, right?
True.
And I'm going to eat your slice out of the fridge at midnight. but we need more sites, more engaged, interested, passionate sites. I truly believe, I was just talking with somebody today, we need sponsors and CROs to take on some responsibility, and maybe that's too stiff of a word, but I think that we need for them to take on some of the mentorship of PIs in particular. And the reason that I say that, I have a very specific reason, is because PIs are the science at the site, okay? And science responds well to science. And so if they have somebody mentoring them who is a physician, a medical monitor, a previous PI on studies, they will get something more from it than if I try to. And again, I don't mean anything good, bad, or indifferent by that in any direction. I just know this to be true. Sure. Okay, so let's give them what they need in order for them to fully understand the oversight that's involved, the mechanics of a trial are not the same as the mechanics as your patient care in your practice. You have to do things differently, more structured, all of that. And then the other thing is, it also comes down to, and I don't know if you're going to put your hands in your ears and say la, la, la when I say this, but we also need the site owners and PIs to really understand that they cannot run a site without proper resources. And this is an issue. It's an issue that and it comes down to money. And why is that? Well, because they don't get very much funding in the budgets many times. And so the budgets do not create any kind of sustainability for sites to grow, right? Now, you might say, it's not up to the sponsor or the CRO to give them sustainability. Well, I would disagree. I think that they should have a bigger piece of the pie so that as a business, they're able to grow into the partnership, serve you better as a partner, and give you what you need, which is clean data on or ahead of time.
I mean, and isn't that, I mean, it seems like good business for the sponsors too.
That's right.
It
does.
It's a win-win. I mean, of course, it's like that thing, it sounds counterintuitive, but it's not. If sites are better supported, they can do better work for their sponsors, and that's really what we all want. I think there's, again, a certain level of irony there when you're trying to nickel and dime a site to the degree that they can't support your trial, and instead, I'm going to go work on the trial that's providing more support and resources, whether it be purely financial or otherwise, because it's easier to do.
I'll tell you something else, having been on this other side of it, Brad. It has created a song and dance. Site tries to figure out new ways to increase different prices of things in order to be able to get the money they need. Sponsor has developed these, we see you and what you're doing, kind of responses. Now, they do have finite money, okay? They don't have infinite money, but, maybe they would spend less money doing it right the first time, and then therefore be able to spend more money with the sites that they get. It's like all of this cyclical, circular, kind of stuff. And we don't talk about it, right? We don't talk about it. It's like the elephant in the room. I'm like, I don't have enough time for you people to not be talking about this shit. Come on.
Right. I think things are getting better. There's more initiatives. I think sites are slowly starting to get,
I want all sites Brad, this is what I'm trying to do. I'm trying to work with sites, get sites together. This is something I'm actively doing. We can talk about this offline another time. But sites don't need to be invited to the table. Sites need to go in, set the table, and bring people in for the best meal they ever had. Part of it is because sites have always felt that they're here. Not very many sites really try to, and let's be fair, they bump into a ceiling when they do. You know that, right?
Sure.
So let's just attack it with numbers and go in and say, we're here. We set the table. We're not waiting to be invited.
I like it. I know you got a heart out here in just a minute or two.
I do.
We'll have you back here sometime. We'll do a full episode. And, I'll be seeing you tomorrow in Raleigh.
Definitely can't wait for that. It's going to be a lot of fun. Yeah. All right, Brad. Thank you so much.
Yeah, thanks for coming on, Maria.
Take
it easy. Bye. All right, I'm going to switch it up, bringing on Emerson.
Hi.
How's it going, man?
Pretty good. Thank you for letting me come on here. Honestly, this is really nice because, I come from the site side of things, and I'm super site focused. So it's been nice to hear what Maria has to say. Anyway, I've been backstage just kind of like nodding my head the whole time. So I guess I'll just introduce myself and
jump right in, man.
Yeah, so I do come from the site side. Right now, I'm working on. I'm the founder of a company that provides clinical trial project management and communication platform specifically for sites. So designed with them, not just them in mind, but really for them. That was kind of like a gap that I saw, and I think this is kind of preaching to the choir. But I just felt like site technologies in my previous experience they wanted to say that they included sites, but it didn't feel like they were truly made for their processes, truly made with an understanding that things on the site side can get incredibly complicated, and they have their own metrics that they need to track and things that they need to like be able to. It's not just like trying to fit them into the mold of, you know, what the CRO expects. They have their own things that they need. And I didn't really find any solutions that were made for them. So
Yeah, I'm curious to hear more about it. I know, like, even this is something that's plagued me in many ways, and sort of oftentimes I found using, you know, already available thing like using Asana we use for a lot of our sort of quote unquote project management, but really, like, you know, especially things like BD and study onboarding, and where there's like a lot of discrete tasks that are done by different people on a team and communicating all throughout that process, things like that. And again, I don't know what your platform does. I just know that, like, these are things that have, again, bugged me all along. There's really nothing that quite fits for what a site does. So I'm curious to hear, like, tell us a little bit more, like maybe what, you know, what were the origins and sort of, you know, where are you at in building this thing out? I'm really curious to hear more.
Yeah, so where I started was I was the first activation administrator. I don't know how common that term is. I've heard that other sites have activation administrators, but it kind of is hit or miss of how people organize their kind of incoming trial process. So at Huntsman Cancer Institute up here in Utah, I was their first activation administrator. So I helped to kind of bring their process under centralized management for how they take in their incoming trials, how they vet them, that kind of pre-IRB process. So feasibility is in there. Sometimes sites, I know Huntsman does have their own internal feasibility process that they do to vet a trial. So all that tracking, process management kind of stuff. And so that's where the product has started, and that's been the focus. While I was at Huntsman, I was also in school again for my software engineering degree. So by the time I was the activation administrator, I had some really good programming chops already. So I was able to build them kind of a custom solution for theirs, and that actually allowed me, one person, to manage all of the, you know, hundreds of trial offers that they're gonna get and vet a
Nice.
year. But like, while I was doing that, I had to keep in mind that, you know, this needs to be something that somebody who's not technical can truly maintain. So I had to make some sacrifices in terms of features that I would have liked to have, notably like external transparency and things like that. It had to be something that someone who's non-technical could keep up. So that's what they have today. But after kind of leaving that role, I was still really passionate about the things that I wished I had, and having conversations with my colleagues there about, like, oh, what if we could, you know, share these things and just have it be transparent while we're tracking our process. You know, someone on the outside can kind of see what's going on. Different things like that. So I decided I was gonna take the time and just build it. I already had a good idea about how, you know, Huntsman structured their processes. I had already built, you know, a database. I just needed to build something nice on top that allowed users to interface with it in a reasonable way. So right now we're ready to take on sites, but we really are also wanting to talk to as many sites as possible to understand what kind of process management they want to do. Like, just like what you were talking about, that's something that, having been regulatory startup before I was the activation administrator, I mostly have startup experience, right? So the details that need to be tracked post startup, I'm aware of, but not intimately aware of. So I just need to, like, get it in front of as many sites as possible so I can know what are the things that you guys would want to track, you know, post. And so that's kind of where I am.
No, that's cool. And yeah, I mean, if you're listening, if you're a site, I'm just going to offer you up. Reach out to Emerson. He'll talk to him. I mean, I'd be happy to show you kind of what we do. I've built out some templates in Asana, which is like project management software, where we've got milestones, we've got tasks that go to each person depending on, you know, what their role is in startup. So I'm really intrigued by how other sites do this as well, because I think it does become, I mean, I can't imagine it doing it in a place like Huntsman, where it's huge, you know, we're relatively small, but even when you're small, it's challenging to keep that communication open, because regulatory is waiting to submit an ICF because they're waiting for the budget to get negotiated for the patient stipend. And you've got so many little points at which communication can sort of fall apart. And so just keeping things, you know, on track operationally can be challenging, even in small teams. So, you know, I love that there's some attention being brought to that, because I haven't heard a lot of options or a lot of solutions out there.
That was my impression as well. It's why I, thought it might be a worthwhile, project to go into, because I wasn't like, it was my job to bring these things in line. And I was like, I don't think there's anything out there that does what we need. And then we got some really nice benefits from it post hoc that we weren't cognizant of at the time, but we know the ratios of trials declined. We know the ratios of trials declined between versus the ones that are offered, right? We can
Right.
tell which team is being selective and which team might not be as selective, or, those sorts of things, which team doesn't receive as many offers, all of those sorts of, we can, keep track, just all of the metrics that you can keep track of once you have an organized way of doing it, right?
Probably start to get a feel for where your bottlenecks are in that startup process. What's taking the longest? I mean, usually it's contracts and budgets, if nothing else. But at least you can start to say with accuracy, you get asked during feasibility, how long does it take you to do this? How long does it take you to do that? Well, I can tell you that it takes me 47 days. I don't have to guess. I can tell you exactly how long it's going to take, because we're able to track, these things throughout a process. And again, I think that's important for sites to have a true sense of their internal metrics. And again, I think that's, even for us, admittedly, we don't do as good of a job of that as I would like us to. Because I mean, at the end of the day, this may vary, depending on some site models, but sites are businesses, man. And I don't think we're tapping into the same sorts of tools and metrics that other businesses do to make ourselves better businesses. And this is, seems like a sort of low-hanging fruit way to be able to start moving in that direction.
Yeah, well, and it goes back to what Maria was saying about the budgets are so, I've been told that, everyone builds products for sponsors because sponsors have the money. And they're like, oh, the sponsors have the money. But it's, I mean, I think that for the sake of transparency and communication and being able to make the site side more efficient by allowing the sponsors to see the things that they need to see to keep track of things and reduce that communication burden is great. But I think that you gotta, you have to provide the sites what they need too, you can't make the platform for the sponsor and then turn around and say that you've made this for sites when it's not providing what they need, in a lot of cases. So I think so. Resource constraints are problematic. And I think that, so our goal is, sorry, I totally lost track. I'm so sorry.
No, you're good. I do it all the time.
So sorry, I forgot. What had you said right before I started getting off of my tangent?
I have no idea. I mean, more about businesses, sites being businesses, and being able to.
Oh, you're totally right. The metrics. Yes, that's where I was going. I'm so sorry. So yeah, I think that the metric tracking is important. And if you don't have something that's made for you to be able to do that, then if you're also resource constrained, so these businesses who can build really epic, smart sheets or, right. Asana templates or what have you, they have people whose job it is to do that, right? Whose only job is to manage that project and make sure that this template looks great and everybody's getting all the data that they need, right? Part of the benefit of having something that is made for your use case, more out of the box, is that, you don't need to hire somebody whose job it is to just manage that. And so, yeah, that's definitely what we're aiming to do. I have seen that some folks use like smart sheets. I know like a lot of folks use, just Excel.
Mm-hmm.
So
Excel gets a lot of mileage at research sites for better
it
or worse.
really does. Yeah. And then you've got to have somebody who can like integrate these spreadsheets, or maybe not. Maybe you don't even have that, and then you don't really have access to the data that you need to make good, insightful decisions about, where your bottlenecks are and stuff. Absolutely right. I could tell you a little bit more about kind of where we are specifically.
Yeah.
So we do focus on the startup process right now. So how it works is we allow your site to define your processes and the more nominal things that you track about a study. So like title, or we call them attributes. So you can kind of define attribute sets and define process sets for your site. It's like a visual workflow we have. You can like drag and drop steps and say where they fit in, things like that. And then once you've defined that kind of at the organization level, you can go ahead and have your studies inherit one or more of those processes or attribute sets. And then that's how you get going with tracking. So during the tracking process, you're able to kind of make these what we call notes, and you can do all of the modern things that you would expect from a platform, right? So you can, mention teammates and have things show up on their homepage to, hey, I need you to take a look at this document. I'm not really sure about it. Or are you interested in this? They reached out to us again, or things like that. You can set your own follow-ups for yourself by doing like a hash mention. So those things will also pop up on your homepage. So it gives you kind of that process management flow. And then the major feature, I think that's somewhat different, although I have seen Advara said that they have something kind of like it, but it kind of seems like it's that thing I was talking about earlier, where it's not super flexible. It doesn't look super flexible to me, but maybe. So where you can basically flag whole processes, notes, things like that as external. And in flagging them as external, you allow the sponsor to transparently see what's going on. So they don't need to ask you where the project is. They also get their summary page. It's not our goal is that the sites are our customers. We think that making them the customer is incredibly important to the incentive structure for what we want to build. Like the next things that we build need to be for you, not for the sponsor. But we do allow sponsors to do things like build a small, basically a flagging page, so that when they come to visit a study, they have their favorites and things like that, so that they can kind of quickly see their studies at a glance and get to them, stuff like that. Nice. But it doesn't require a login or anything like that.
Nice.
So,
yeah, I like that. I feel like so much of what we do lives in random email chains. Yeah. And it becomes incredibly complex again when you're involving, even at the site level, you might be involving contracts, budgets, regulatory operations, but then you've got the same or more happening at the sponsor or CRO level. Someone's trying to schedule an SIV with you, but the contract's not even done yet, and nobody knows who's doing what, when, and where. So again, I've always loved the concept of if there were a platform or somewhere you could go just to see the progress of like what is going on. I don't know if that's exactly what you're describing, but essentially if you go there and say contract is near completion, IRB submission is done, whatever, again, somewhere where everybody can tell just what the hell's going on, because it blows my mind that in 2025 it's so hard, for everybody to stay on the same page.
Yep. And you're exactly, that is almost exactly what we're building. So the external page looks a lot like that. So the landing home page has your like basic summary. So we just tell you like, we can estimate how, far along the process is. So like this % complete for budget, for contract, for this, for that. So like on your summary page, you get kind of that high level information. Then you can dig in a little bit if you want to see what date certain things were completed. As long as the process is external on the site side, we should be able to see all of that. So actually we're going to be in the coming weeks, we're going to start dropping a couple of small demo videos. So folks will get to start to see kind of what it looks like.
Sure.
But I think the ongoing processes, like what you were talking about, with your Asana workflows, even post activation, that's something that we've heard from multiple people now, that they would love something that continued to allow you to do things like recurring processes, like maybe, all of that sort of tracking. So that is something that's been on our radar. And
yeah, and we've managed to find some ways to sort of work with that. So I'd be really curious to sort of compare notes at some point, and even beyond that, if you're interested in coming back on. I used to do on here like a series of live demos, like as much as possible. So if that's anything you have interest in, I'd love to, love to see it, get it out there to some more people, probably get you some more feedback as well. But again, I find that fascinating. I think it's something that's been like weirdly absent in the space. So I applaud you for attacking it. I mean, again, I think it's worthwhile for sure.
Thank you. It's really, it's really good to hear, because, you spend all this time kind of building things, talking to a few folks, and like the more folks I end up talking to and showing, the more I see, okay, I wasn't super far off base with this. Like Huntsman isn't the only person who needs these services. So it's good to hear.
I love it. Where can do you have a website set up yet or anything where people can check out some
so we do. Yeah, we do have a landing page. So it's Succinct Software. I can put it maybe in the chat. Let's see, comments. Am I not joined in the chat? Oh, no.
Yeah, it's kind of weird on the comments. If you put it in the private chat, I can throw it up on like a little banner across the bottom. I think StreamYard is always a little hit or miss sometimes, but
so that's our landing page, and folks can always like connect with me via LinkedIn, send me a DM. I'm happy to chat with pretty much anybody. So so that's our webpage, and then we also have like an info email. If folks want to email, they can also email me at succinct.com. So I'll send you those too.
Yeah, make sure I'll throw them in the show notes. For some reason, the banners thing is being... Oh, here, let me see if I can do this. Boom. Let's see if this works. All right.
Sweet. Yeah, and we should totally connect and compare notes, or chat again for sure.
Yeah, no, we'll connect offline for sure. 100%. Cool, man. Anything else before we sort of wind down here? I expected a little bit more from the people who had reached out, but it's okay. We're getting down to our last few minutes. If anybody else wants to jump in at the last second, by all means, go ahead. But probably gonna shut this thing down here in just a couple of minutes. But anything you want to end on, man?
Check us out. Reach out to me. And I'm super happy that you invited us to come on here. I've had a great time. Thank you.
Yeah, no, I want to continue to, bring out more voices that generally aren't on these sorts of things. And it's a good opportunity to do that every now and then. Just kind of open it up, see who's brave enough to come on and talk. And I love it. So cool. Okay. Well, I think that's it. I'm going to, throw our outro out. I will be... there'll be no show on Thursday. I'm going to be out of town. We'll have the sticky notes next Tuesday. I think Dr. Daniel Fox will be on next Thursday. So you guys stay tuned. I'll get all that stuff scheduled. Emerson, thanks so much for coming on, man.
Yeah, thank you.
All right. Take it easy, guys. Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.